When we first moved here, we met too many people who were having to trip to Seattle on a daily basis to receive cancer care.
Often the biggest obstacles to patients getting care is their location or something else that is going on in their life that makes it hard for them to come and go from the cancer center.
I can personally tell you from cancer with my husband, it changes your life dramatically. It changes it emotionally, financially. It's an impact on your family, your friends, your work. It's a complete life changer.
It can be a huge financial burden for patients who have radiation treatments every day or chemo treatments every week or every couple of weeks. And a lot of the patients would not be able to have treatment without the support. And that is a really unique thing to have here.
When my wife went through her radiation treatment, didn't have to travel to Seattle. It was interesting to hear from other people who had gone to Seattle. The doctors in Seattle wondered why they were coming to Seattle when we had the best facilities in Sequim.
I had a wife that needed treatment on a daily, a weekly, and bi-weekly basis at different times, and we're able to walk in and have very educated staff. I'll go from the CNA to the medical assistant to the RNs that have been trained in oncology and the physician staff to care for us in a way that I felt very comfortable that I was being taken care of correctly.
So we have a really excellent comprehensive cancer center for a community of this size. I hear that all the time from patients, and I know that from having been at large cancer centers in other parts of the country. Really having everything in one place under one roof at this level is really uncommon. A lot of places, medical oncology is in one building or in one hospital, and radiation oncology is in a separate place. And so getting the doctors to work together and getting things done from the patients for the patients is a lot more difficult.
One of the amazing programs is the Patient Navigator, and I consider it the compass of the cancer center. You've just come from a diagnosis. You've got cancer. You're trying to figure out what all these treatments are going to mean. It is an incredible gift to just make every day you got to deal with cancer easier.
The fact that it's here in Sequim and convenient made a big difference. Yeah, it meant a hell of a lot for my wife. Very good people work in the cancer center, and that made a big difference to her to be able to talk about it with people that knew what was going on and how it was going on.
The community support and the foundation are very instrumental in getting a lot of the things that we've accomplished here in the last few years. So in radiation oncology, for example, we use these dosimeters to measure that the doses of radiation when we're treating skin cancer specifically are correct. And so that's just an example of something the foundation has helped us to buy the systems to do that, so we can do it here on site. We were previously able to do it, but we had to send them out in the mail, and so it would often take a couple of days before we got a response. And so that's just one example of something they've given us to help us deliver. They also help in radiation oncology with our 3D printer, which allows us to make more technically perfect radiation treatment plans.
We are a public hospital. We are not a private hospital. So the community owns the hospital. The community has a vital role in its healthcare in having a hospital. OMC provides care to everyone. No one is ever turned away, and that takes a financial support.
The foundation, I think, helps not only raise money, but educate the communities as a whole as to, one, what cancer is, and two, what we have available to us local.
You know, with cancer today, there's more and more people getting cancer and getting a variety of types of very aggressive cancer. So you would think, well, I'm not a big donor myself, but I know that my consistent donations makes a difference. And I can tell you that because it makes a difference from the simplest thing, from maybe helping someone get a ride here to get to treatment, as simple as that, to something as complex as a multi-million-dollar piece of equipment. Every dollar matters here, and every dollar is put to use to make a difference in a patient's life.